I was cornered at my sister's wedding by my mom and her friends to start making videos on menopause. So here we are. So it is quite often that I am having patients in the office or talking with people and they're wondering, are they in menopause? Are they in perimenopause? Does it matter? Are there treatment options? And so we're going to go through all that. Stay tuned. Welcome back to the New School OBGYN. It matters where you get your information, and we're looking to debunk all the biggest myths in women's health so you get the best information. With all that being said, my name is Eric Schmidt. I'm a board-certified OBGYN, minimally invasive gynecologic surgeon, and we're going to be spending a bunch of time talking about menopause, perimenopause, all of that, so stay tuned. The question I sometimes get is menopause abnormal? No, it's not. It's not a disease, but that doesn't mean you don't deserve to be evaluated and potentially treated. I think too often, as with many things that I see in the office, people are going with, out treatment for certain things because they just think they have to put up with it, or they're scared to talk to their provider because they may feel they may be dismissed. And I think that has happened way too often. And so let's talk about menopause and perimenopause so we can hopefully better make people aware and hopefully get them the treatment, if they want it, that they deserve. My hope is that this channel is driven by its viewers. And so if you have any questions regarding menopause or just want general information about one thing or the other, please leave a comment below. We'll get to it. So let's start with one of the most basic yet complicated questions about menopause. What is it? In our teaching as medical students, or if you read a textbook or Google it online, menopause is defined as the absence of menses or a menstrual period for 12 months or 1 year. Menopause is so much more complex. Perimenopause is so much more complex. And we're finding more and more information about how if we potentially treat these things, we can improve not only lifestyle, but a woman's vitality, their ability to live and function more normally. And for that reason, I hate that diagnosis, yet that was on our tests. Traditional diagnosis of menopause with the absence of menses really only is attributed to one of the symptoms of menopause, and that's the bleeding symptom. And there's so many other symptoms through menopause, or so many other things through perimenopause that can potentially cause adverse symptoms, cause adverse health consequences. So it needs more discussion, and we need to be more flexible in our treatment of these symptoms as practitioners, because women deserve better. So this is why I kind of like the term better, perimenopause. And if we look at the chart here in the table, perimenopause generally is a time period just before the actual final menstrual period, or FMP, and it extends beyond that to incorporate a lot of the time where someone is the most symptomatic with certain symptoms or bleeding irregularities. And so, perimenopause, in my opinion, is just a lot better of a term to potentially use to describe this time. You can also see that perimenopause generally can last anywhere from 1 to 2 years up to potentially 7 to 8 years. This is when when your body is going through all those big changes and hormonal changes, with the ovaries being a little more inconsistent with our hormone production. And that's what develops, in a simplified ways of saying, that's what's going to cause a lot of these symptoms, is the irregularities in the hormones when the body was used to more regularity previously. So what's the average age for all this to happen? The average age in North America of menopause is approximately 51 to 52 years old, but we consider any time really after 45 to be the normal time frame of when someone may go through menopause. Another big factor that goes into this is someone's own family history and their own genetics. And so if you're talking to the women in your family, hopefully the women in the family do talk about this, because it matters a lot for what that other person can expect. I think it's, again, too often where sometimes people don't talk about these sort of things. It's kind of taboo to talk about it. And so hopefully, again, more discussions, more open conversations about this can lead to more conversations and that person be able to take action potentially. If somebody's going through menopause age 40 to 45, this is kind of an outlier. This is called early menopause. And so you definitely want to talk to your provider, go seek help should you be going through menopause a little bit earlier, because again, we can offer certain evaluation and potential treatment. Even more of an outlier would be if somebody's going through menopause before the age of 40. And you may have heard a couple terms to describe this. We call it primary ovarian insufficiency, more of a medical term. People often describe it as premature ovarian failure. I feel like that's more of the old medical term that is more used in the general population. This definitely needs evaluation and treatment. Next question is, well, what triggers or what causes perimenopause or menopause? And it's actually the depletion of the eggs in the ovary, and that signal you might hear me describe as a very delicate cycle of the signal between the brain, hypothalamus, and the ovary. When those eggs start to go down in number, and that really happens kind of exponentially since birth, is that there's less of a feedback signal from the ovaries, and so this now inconsistent signal, inconsistent ovulation, leads to more hormonal shifts, hormonal changes, and eventual decrease in those sex hormones, progesterone, estrogen, testosterone from the ovaries that causes a lot of these symptoms that we see in perimenopause and menopause. To summarize all this, do we need to redefine menopause? In my opinion, yes. It's only the definition of menopause really is only attributed to the bleeding symptom. And we'll talk more about that. We'll talk about all the symptoms. And so we need to refocus it. We need to prioritize and optimize the health of those individuals going through this process. And it shouldn't be minimized. It shouldn't be shrugged off. If you feel like you are by your provider, find a new one. And so the time has come where we stop minimizing these symptoms and shrugging this off. Thank you everyone for listening. We'll talk to you soon in the next one. For those that are not new to this channel, you can clearly see I dressed up for this video. Welcome back to the New School OBGYN. We are looking to debunk the biggest